Right. So thank you, Alastair, for taking the time on this Friday afternoon to speak to me as part of the King's Spotlight on COVID. Can we start off with you telling me a bit about your background and your work at King's?
Yeah, sure. First, it's really exciting to be here, and we're really happy to share the news that we've got this Innovate UK grant. My background and work at King's actually comes from my PhD. So I've studied a PhD in brain tumours and neuro-oncology over at King's College Hospital. And now I think a lot of people can sort of relate to this. I was chucked into the back of a neurosurgical theatre without any medical training, without really knowing what I was doing. And I think for the first few weeks, I tried as hard as possible to disappear into the walls. But that's where I picked up lots of books and really threw myself into really getting to grips with the clinical side, meeting patients, understanding surgery, but understanding it from a science perspective. And that really was my PhD. So I studied how electrical activity really changes in the brain and changes how tumours progress. And this is where it opened me up to a whole new world of neurosurgery and what happens in the clinic and where doctors really implement science. So I've been really lucky enough at King's College London to get that first-hand experience directly in surgery, and even better yet, then apply science to that clinical experience and produce papers. And this is where really Vivisco has been born out of that, trying to apply science directly to solve clinical problems. And this is where I've gone on to meet my co-founder, Dr. Christopher Russell from the University of Leeds, and my old undergrad university. And together we've come together to form Vivisco to really take electronics and electrical engineering and apply them to the most pressing problems in healthcare.
Amazing. So can you explain a little bit about how how like the technology behind Vivisco works and the like activated compounds and how these can be applied?
Yeah, sure. So this has been going on in science for sort of 20, 30 years. It's a really complex idea. So I'm only ever going to touch the sort of outer regions of it. So it's not going to be a hardcore explanation. But these light activated compounds are exactly what we said. They're drugs or compounds, pharmaceuticals that are activated by light. So as simple as shining a torch on them, these become activated and they produce something called reactive oxygen species, ROS for short. And these reactive oxygen species can go on to do damage to other cells. So they can be used as a treatment for cancer, for example. They're actually used in surgery where I was first introduced them to mark cancer cells. So we can make sure we remove all of that tumor, or we can look at blood flowing through blood vessels because it becomes fluorescent. So this is where I was introduced to them. And I think what's really exciting about these drugs, there's lots of different classes of them. They've been around for a while, but their application hasn't been fully explored in other conditions. And at Vivisco, we're building the medical devices that unlocks these other applications, because we believe the drug is important, but the medical device that provides that light is just as important as well.
That's so exciting. Can you explain a little bit about what are some of the issues that are facing the wider uptake and application of these compounds, and how does Vivisco and the technology you're making seek to solve it?
Yeah, sure. So I think it comes back onto that point where actually me and my co-founder, are both really excited that there's lots of potential applications. When you look at some of the spin-off of these drugs, one drug has been used as a cancer treatment. It's also been used as a treatment for acne. So there's lots of applications from these one drugs. The problem is, how do you design the medical devices properly so they're easy to use, easy to fit into the clinic, and people want to use them? And this is where we think it needs as much focus on that device as it does the compound you're activating. So we specialize in microscale electronics and applying that to a biological application. So that's how we aim to solve this problem, by really focusing on how we deliver the light.
Great. And obviously congratulations on your recent funding from InnovateUK. Can you tell us a little bit about the bid you submitted and how the technology can be leveraged in the current fight against the COVID-19 pandemic?
Of course, this is something that we think is really, really important from a business-led response to the COVID-19 pandemic. Whether we can attack this pandemic or provide future proof for the next pandemic or even influenza, or sepsis, for example, coming down the road. And what we do is we use these reactive oxygen species, we activate them with light to see if they can destroy viral particles. So this has been around for a few years as an idea in academic research. We're now building the medical devices to apply this to COVID-19. And it's as simple, really, as taking an everyday light bulb, an LED, you might have heard about it, and we can make these really, really tiny. You've probably got an LED sitting on your desk right now. Imagine that, but really, really small and directed to the place where your infection is highest in the body. So we take these LEDs, make them very small, get them into the lungs, get them into the blood to really provide a treatment for COVID-19 and subsequent infections. And now we're really excited because what we're making here, I would say, isn't really a treatment. We're making a supportive care. So we're actually not going to be able to reduce all of the virus like the targeted drugs are. But what we can do is hopefully hold those viral infection levels down so that the body's own immune system can take effect, or other treatments can come in and it can actually exponentially increase their effect, overall improving the patient. And this is really, really exciting for us because this has implications not just for COVID-19. If we get this right, this goes much, much further because it's not targeted against an RNA structure or DNA, which are the building blocks of life. It's targeted against a general viral structure, a lipid membrane is what the virus is held in. If we can target that, we can have a new treatment going forward for unknown infections. And that's what's really, really excites us.
Wow, that really is incredible. So, I mean, apart from this, obviously, what do you see next for Vivisco?
Yeah, I think the future is really, really exciting. We've got lots of ideas from neurosurgery. We've actually got small products being in conceptual phase for identifying tumour margins, but we're focusing on this viral product. And we're just closing now our pre-seed round. And going forward, I can see us in September, October, starting to make our key hires and really pushing forward to get this into first in human use. I'm really excited about the future, and hopefully soon you'll see some of our papers coming out from our academic collaborations on COVID-19.
Amazing. Wow. Well, thank you so much for your time, Alastair, and
No
good luck
problem.
with everything.
Thank
Cheers.
you very much.